IAMA. I am reporter Julie Mack and I am here to discuss Michigan's mental health crisis and the glaring issues in the state's mental health system. Natasha Robinson, a mother personally affected by this crisis, is here with me. AMA. For far too long, psychiatric disorders have been shrouded in shame and stigma, and mental health has been the poor stepchild of the American healthcare system. It's estimated that half of Americans will experience a mental health issue at some point in their life. Half. And yet the stigma lingers. The stigma is a killer. Literally. In Michigan, it takes an average of 19 phone calls to find an inpatient psychiatric bed. 33 counties in Michigan lack a psychiatrist. Meanwhile, our reporting shows the number of suicides in the state hit a record high in 2017. It's an issue that hits home for me. And it hits home for Natasha Robinson. She was willing to share her story with all of us about her son, who was 6 years old the first time he tried to kill her. She is with us today and her story, along with our reporting on Michigan's mental health crisis, is below proof.
Deleted.
MLiveSocial, this is Natasha. I started with reaching out to our local community mental health (CMH) organization. In most states, you can call 211 and they can give you information about your local CMH. Your local CMH should be funded to accept you regardless of your income level. You're already breaking the cycle by having a desire to get help. Additionally, if you're near a health system that also has outpatient psychologists or psychiatrists and you're low income, they may have foundation funds or a patient assistance program that will help cover co-pays. Don't stop trying.
Deleted.
MLiveSocial, thanks for your comment and your question. I would reach out to the National Alliance on Mental Illness to find out what resources are available in your state. There are programs and support groups available for people in your situation, so I would highly recommend reaching out to others.
Intimate_jogger, why are outcomes for treatments of mental illness like depression so poor? Appreciated X.
MLiveSocial, this is Julie. My editor and I were talking about this just yesterday. There's still a lot we don't know about how the brain works and how to effectively address mental health issues.
Photoproxima, can you comment on Lara's attempt to limit the scope of practice of LPCs and the legislature's attempt to pass legislation to stop them?
MLiveSocial, this is Julie. It certainly seems troubling the state may be pulling 10,000 counselors out of business at a time when there is a big shortage of mental health providers. That said, I get that Lara feels a need to enforce what they feel is the law. I was at a legislative hearing yesterday, and got the strong impression that lawmakers are working hard to fix the issue. Here's a link to a story I've written about the situation.
Photoproxima, can you comment on Lara's attempt to limit the scope of practice of LPCs and the legislature's attempt to pass legislation to stop them?
MLiveSocial, this is Natasha. It's terrible. My personal therapist is an LPC and I value the service provided, the connection offered and the fact that I don't have to wait months to be seen. If my LPC and others aren't able to provide the level of services they are now, it will be a disaster and I'm guessing folks will probably want to leave the state in favor of jobs that allow them to continue to provide therapy.
I gave up. Is there something specific to Michigan's systems that make the mental health crisis more pronounced there, or is this really a nationwide problem?
MLiveSocial, hi. This is Julie. Thanks for the question. This is a nationwide issue, although it plays out a little differently in each state. We focused on mental health issues in Michigan because MLive is a Michigan-based media group that focuses on state and local issues.
Zactalone, are those on Medicaid less likely to get help? It seems to me that they might have a higher percentage of folks who need mental health assistance.
MLiveSocial, it's certainly true that people on Medicaid are more likely to need mental health assistance, which makes sense, since mental health issues can impact your ability to work and thus you're more likely to be low income. In terms of less likely to get help, I think it can work both ways. On one hand, CMH has a lot of resources for families such as Natasha who rely on Medicaid. On the other hand, private insurance might provide quicker access to some providers. Thoughts, Natasha?
PhD_dude. Hi Julie. Last year, only 84% of U.S. fourth-year medical students were able to match into a psychiatry residency program, compared to approximately 95% of students wanting to pursue neurology. That means, 16% of qualified U.S. students who wanted to pursue psychiatry could not because there were not enough training spots. This shortage is largely to blame on the fact that Congress has not significantly increased the number of residency positions, even though more medical schools have sprung up, and more students are applying. What are your thoughts on this as being part of the issue? How can we encourage Congress to increase the budget and open more residency spots to meet the demand?
MLifeSocial, this is Julie. I don't know any good solutions, but top on my reporting to-do list is to look harder at the shortage of psychiatrists and how to address it.
Candilathere, as someone who moved from Pennsylvania to Michigan 2 years ago, I was appalled at the lack of psychiatric care, especially those who would take my Medicaid insurance. I'm lucky enough to live near Ann Arbor, but even here it's a struggle. How would you urge psychiatrists to take more insurances, especially Medicaid? And how would you draw more psychiatrists to Michigan specifically?
MLifeSocial, this is Julie. Not sure about the insurance issue. But in terms of luring more psychiatrists to Michigan, one idea being floated is a loan forgiveness program to offset medical school debt. Pay is another issue. Psychiatry takes lots of training and the reimbursement rates aren't great, so improving that would help. A third idea I've heard is working with medical school programs in the state to encourage more medical students to go into psychiatry.
Eurostylen, hello Julie. How do you feel about Democratic Governor Gretchen Whitmer putting her whole campaign being pro-health services, yet turning around and cutting $210 million to health services, including mental health? Do you feel like she has really turned her back on the people who need her most? Source:
MLifeSocial, I haven't looked closely at Whitmer's budget decisions or her rationale behind it, so I can't offer much.
RAL 315, do you think that there's a clear way forward to reverse the growing trend of mental health episodes in Michigan? Is there a lack of funding, a lack of focus, or a lack of prioritization from the legislature, DHHS?
MLifeSocial, this is Julie. Certainly, the lack of funding and prioritization are issues. We're hoping this series puts more attention on this issue.
One-armed_paperhanger, one major reason for people in acute crisis not to seek help is that they're afraid of being locked up, committed involuntarily. How does this possibility jive with the inaccessibility of inpatient care to those who want it?
MLifeSocial, this is Julie. Both can be true, right? There are some people who don't want inpatient treatment, even when those around them feel it's necessary, and those who want inpatient treatment and can't get it.
Semirunner, this is a question for Natasha. How is your son doing? In the series, he was just starting to finally get some of the help you had been seeking for months. Is it helping? Also, how have people responded to learning about your story?
MLifeSocial, this is Natasha. He's doing all right. We are weaning off meds and I'm happy with the progress made so far. It's hard for him to be away, but he's trying to enjoy the activities, schooling, and friends he's made there. He is starting to engage better with his therapist there. I'm hopeful we'll have positive momentum that will transfer to home life. People have been incredibly kind and sensitive for the most part. Many have been giving, which has been so helpful because the financial hardship is real. Other parents are reaching out saying they thought they were the only ones with this type of problem and now they don't feel alone. It's really heartwarming to know that people all over the world are praying for my family. I'm glad that people saw my heart and that I'd do anything to help my son be happy. I am making new mom friends. I've also gotten lots of information about other possible diagnoses to look into, rule out. It's a blessing.
Frute, can you give me any advice? As a veteran, I've been to the VA for the past 5 years on and off. In and out of psych wards. I've been on about 20 to 25 different medications. 2 different suicide attempts. I've tried to seek care through civilian healthcare and they keep telling me I'm better off going back to the VA. After one suicide attempt I begged to not get sent to the VA and that's where the civilian hospital forced me to go. I was cooperative as well, but they said the cops would have to come in if I kept refusing to go the VA. I was requesting a civilian psych ward in Marquette as well. I was trying for help, just not the VA. Now I quit my medication in April, slowly tapered off, and now my mental health problems, mainly extreme panic attacks and anxiety, are coming back. I'm so sick of being stuck in that circle at the VA, I'm scared to go back. Do I have options better than the VA at my disposal? I'm located in the Upper Peninsula.
MLive Social, this is Julie. Wow, I'm so sorry to hear your story. Feel free to email me at jmac1@mlive.com, mail to jmac1@mlive.com, if you would be willing to be interviewed for a future story. Off the top of my head, I would contact your CMH and or the Michigan Alliance for Mental Illness to see if there are other options.
Todd Packer 420, do you think that the reopening of asylums are a valid way to address the mental health crisis?
MLive Social, this is Julie. As I said below, because state psychiatric hospitals don't qualify for Medicaid, there is no appetite for reopening or expanding those facilities. The focus has been on expanding beds in the private sector, which do qualify for Medicaid as well as private insurance.
Throw_away_license. Hi, how exactly is that bipartisan funding intended to be used to help people in crisis situations? From my experience, and from others I've known, inpatient facilities are a useless, dehumanizing experience that's only good for racking up medical debt. That isn't to say that there aren't people who need it, but the treatment received on facilities is to take away any autonomy you have and leave you to rot in some crappy rec room.
MLive Social, this is Julie. In talking to lawmakers and MDHHS folks, there most definitely is a push to expand the range of services so that people don't have to use inpatient services. Those expanded services would include things such as behavioral health urgent care, mobile crisis teams, and more intensive day programs.
Tight grunt. Hi Julie. Thanks for doing this AMA. Has any research been done as to the effect of the drinking water crisis, lead exposure, and the mental health trends that you're all seeing?
MLive Social, I haven't looked at that angle specifically, but I did see a headline recently that indicated Flint schools is seeing an uptick in special education enrollment. Here's a link.
JMC15 John, has Michigan thought of modeling its system after another state that's more successful? I'm sure no state is perfect, but I'd assume there are at least a few that are doing a good job. I used to work in Virginia, and in the Hampton Roads area we could almost always find a bed for someone while getting them evaluated during our 3-hour window.
MLive Social, this is Julie. I know that state lawmakers such as Mary Whiteford, the state rep from South Haven, and the new state director of mental health services are looking at other states to think about what Michigan could be doing.
Draw on the Black. Hi Julie, do you have an opinion on the role of economic insecurity and its effect on mental health? How has automation displacing work affected the many in places like Michigan that have been forced to seek other paths?
MLive Social, this is Julie. It's not the only factor, but it's certainly a factor. It's not a coincidence that mental health issues are more prevalent in communities under economic stress, and suicide rates tend to be higher in those communities, too. Interestingly, on how it's not the only factor, while African Americans are 3 times more likely to live in poverty than whites, blacks are less likely to commit suicide and slightly less likely to be diagnosed with a mental illness.
Leopard Bernstein, so amidst this mental health crisis, why do you think Michigan is trying to take away the ability of licensed professional counselors from doing their jobs with the Lara rule change? Seems pretty amazing to me that the legislators are not doing more to prevent the rule changes before the new House bill goes into effect. This has the potential of stranding 300,000 patients by tomorrow. Any new info you can add to the state of the rule change, or the new bill to permanently set LPCs as legal mental health providers as they are in every other state to circumvent the rule change.
MLive Social, there is a Lara hearing tomorrow, but the earliest the rule change would go into effect is November. It appears state lawmakers are scrambling to pass a rule before then to head off the rule change.